All right, this is the second recording for Chapter 8 on joints. And I was telling you in the previous recording that for these synovial joints that I was going to focus more on the shoulder and the hip joint and then also the knee joint. So I will read through the elbow joint information, but I won't ask you to know specifically the names of the ligaments, and I won't go into detail on the elbow joint. I would expect you to know that the elbow joint is a hinge joint. It allows for flexion and extension. But then, I said that in the first recording. So this is a picture of the elbow joint so you can see which bones come together. There's the ulna. You may remember seeing the little depression it's called the trochlear notch, but the depression at one end of the ulna. And then the trochlea is the portion of the humerus that actually connects with the trochlear notch of the ulna. So this is where the humerus, where the humerus meets up with the ulna. You can see in the elbow joint there's several bursa, or there's a bursa, but there's more than one. It just doesn't show it there. There's fat pads, tendon of the triceps muscle, tendon of the biceps muscle. This is the brachialis muscle, and basically similar components as what we saw, in the shoulder joint. The elbow. Okay, I will tell you this. All right, the part where your elbow makes a point, like if you hold your arm up and you touch you touch your actual elbow, that is the olecranon. It's called the olecranon in our body region terms, but it's also part of the ulna. It's a projection of the ulna. So, okay. So the ulna, this part of it, is called the olecranon, and that is the projection that actually forms the elbow itself. Now, for the hip joint, which is also called the coxal joint, we do need to go into more detail, and I'll expect you to know more detail about it. It is a ball and socket joint. It's similar to the shoulder joint, but with the hip, there is more stability, so less range of motion. The range of motion is limited by the deep socket of the hip. If you remember, the shoulder joint had a shallow socket. It had to be built up by the glenoid labrum. Now, there's another labrum has the same purpose as the glenoid labrum of the shoulder joint, but it's called the acetabular labrum. And that is a rim of fibrocartilage or a lip, an extra lip, that enhances the depth of the socket. So hip dislocations are very rare because the socket's already deep and it's built up and reinforced by that acetabular labrum. Okay, so you have, for the hip joint, you have this really head that really sticks out. There's a larger neck on the femur. There's not really a neck at all on the humerus, between the humerus and the head of the humerus. So here's your femur, and you see that the large head and the long neck of the femur, and the deep cavity that it fits into is formed by the acetabulum. The acetabulum, and see, this is a good animation to watch. It's on slide 35. I would encourage you to watch it. It's just an overview of movement at the hip joint. And this shows you the head of the femur, and then it shows you the acetabulum, which is the cavity here, the acetabulum, and then there is the labrum that's built up, the acetabular labrum. The ligaments that reinforce the hip joint are the iliofemoral ligament, which, just like the name suggests, the ligaments are named for the bones that they attach. So that attaches the femur to the ilium, the femur to the ilium. And remember, the pelvic bones are divided into the ilium, the ischium, and the pubis. So the ilium is the big wide part of the pelvic bone. Okay? Then we have the pubofemoral ligament, and that attaches the femur, thigh bone, to the pubic bone. Then you have an ischiofemoral ligament, and those attach the femur to the ischium of the pelvic bone. The ligamentum teres is at the head of the femur, ligamentum teres. The greatest stability of the hip comes from the fact that the socket is very deep. That acetabulum forms a very deep socket. Okay, so the acetabulum is actually a depression in the, I think it's the ilium though. I'm sorry, I needed to look that up. And now I know why I had to look it up. So the acetabulum, which is, you have to picture this because you can't really see it. Let's go back to another picture. Okay, here. All right, the acetabulum is this depression where the head of the femur fits into it. That depression is actually not in one of those pelvic bones, just one of those pelvic bones. It is a depression that forms, and it forms from the fusion of all three bones. So you can really just say it's a depression in the hip bone itself, because part of it is in the ilium, part of it is in the ischium, and part of it is in the pubis, or the pubic bone. So the acetabulum, we're just going to learn that that is a depression in the pelvic bone or the hip bone where the head of the femur fits into it. So now, and this part of the pelvic bone is the ischium. This bone here is the ischial, or this projection is the ischial tuberosity, which is your sitting bones. So when you sit down, that's what you're sitting on. And then this is the pubic bone, and up here is the beginning of the ilium, which is the big wide part of your pelvic bone. So the ligaments that you see are the iliofemoral ligament, which is attaching the ilium to the femur, and then the ischiofemoral ligament, which is attaching the ischium to the femur, and then the that's the only one shown here. Okay, the pubofemoral ligament, which you can see if you look at an anterior view. Now you can see the ischial tuberosity on the posterior side. So here's your pubic bone, and here's your ischium, and then up here is the ilium. But you can see now the pubofemoral ligament that attaches the pubic bone to the femur. Okay, now we're going to talk about the knee joint, which is really three joints surrounded by a single cavity. It's the largest, most complex joint of the body, and which is why I always cover this one. It consists of three joints surrounded by a single cavity. So the joints are the femoropatellar joint. That's going to be the joint that forms between the femur or thigh bone and the patella or the kneecap. And it basically, you don't want a lot of movement there, but it does allow a little bit of gliding when you flex your knee. In other words, when you bend your knee. Then there is a lateral joint, and then there is a medial joint. Together, those two joints are called the tibiofemoral joint, and that's where the tibia and the femur, in other words, the shin bone and the thigh bone, come together. And there are lateral and medial menisci, those meniscus that's kind of a pad of fibrocartilage that's shaped like a triangle, which provides some stability. But this joint allows flexion and extension, some rotation, but you can get injured if you try to rotate your knee too much. But anyway, flexion and extension for sure. You can bend your knee and you can extend it. So let's look at some of the structures. You definitely have bursa. says suprapatellar bursa. That means it's above the kneecap. You also have infrapatellar bursa, and that means it's below the kneecap. So these bursa are to help reduce friction between the quadriceps and the femur, and then between the tendon. The patellar tendon is actually a continuation of the quadriceps tendon. So you see how the quadriceps tendon connects the quadriceps muscle to the kneecap. So it's called the quadriceps tendon here, and then it's called the patellar tendon, or patellar ligament, I think, because it's connecting bones. But anyway, it's the same structure. It's just that because the patella forms within that structure. So the structure that is the quadriceps tendon and the patellar ligament is the same thing, and the patella actually forms within that structure. So here's the patellar ligament, and it connects the patella to the tibia. You can see the lateral meniscus here. There's one here, and there's one here, and that we're only looking at the lateral side of the knee, the side of the knee, rather than the medial side would be on the other side. But I want you to notice the cruciate ligaments, because this is a good picture of the cruciate ligaments. They form a cross, which is why we use the term cruciate, and they connect the inside part of the femur and the tibia. So there's the posterior cruciate ligament that crosses over to the back side, posterior side. And then there is the anterior cruciate ligament. So that's you can see on the front side. See, I mentioned the bursa. There are definitely many fat pads. Okay, and then here is a picture on the inside of the knee of the posterior and the anterior cruciate ligaments. You can also see the articular cartilage, the meniscus, the lateral meniscus, and the medial meniscus, and what they look like from a different view. All right, this is muscles that cross the knee joint. No, you don't have to watch that. Okay. I talked about that. The knee joint, okay, here's more about the knee joint. You can see the muscles, the thigh muscles, which are called the quadriceps muscles. In the next chapter, we will learn the names of those muscles, because you'll have to know those, and you'll have to know the hamstrings, and you'll have to know the muscles of the rotator cuff of the shoulder. But you can see here the tendon of the quadriceps femoris muscle and the patella, and then the patellar ligament. This would be on the anterior view of the knee. And you can also see there is a lateral patellar retinaculum. There's a fibular collateral ligament and a tibial collateral ligament. So the fibular is connecting the fibula to the femur, and then the tibial collateral ligament is connecting the tibia to the femur, and they provide lateral support or side support to the knee joint. I think that's it. Okay. So for these ligaments, lots and lots of ligaments that support the knee joint. There's the fibular and tibial collateral ligaments. The fibular is on the lateral side, and the tibial is on the medial side of the knee. And what they do is prevent rotation when the knee is extended. So they prevent the knee from rotating, which would cause damage. There is the oblique popliteal ligament and the arcuate popliteal ligament. The oblique popliteal ligament stabilizes the knee joint at the back, or the posterior side, stabilizes the posterior knee joint. And the arcuate popliteal ligament reinforces the joint capsule posteriorly. I'll never ask you about those. I will ask you about the collateral ligaments, and I will ask you about the cruciate ligaments for sure. And you can see the tibial collateral ligament and the fibular collateral ligament. You can see here the oblique popliteal ligament on the back side of the knee. Okay, and the arcuate popliteal ligament here, but I won't ask you about those. Now, you do need to know the function of the ACL, the anterior cruciate ligament. It prevents, so it attaches to the tibia on the anterior side. That's why it's called the anterior cruciate ligament. And it prevents the forward sliding of the tibia. So it prevents hyperextension of the knee. Okay, that's what you need to know. It prevents the hyperextension of the knee. Extending the knee is just straightening it out. But then if you hyperextended it, that's not a natural movement. We're not supposed to hyperextend our knee. So it prevents that. And then the posterior cruciate ligament attaches to the posterior tibia. So it attaches to the tibia in the back of it. And it prevents the backward sliding of the tibia and the forward sliding of the femur. So again, the cruciate ligaments stabilize that knee joint from the inside, basically. And here you can see them a little bit better. So the ones that are in bold, I would expect you to know: fibular collateral ligament and the tibial collateral ligament, and then the ACL and the PCL. So make sure you know the ACL prevents hyperextension of the knee, and make sure you know the collateral ligaments prevent rotation of the knee. And here's a picture on a cadaver. All right, and then real quick, common knee injuries involve the 3 C's. So the knee is really, really vulnerable to horizontal blows from the side, okay? So common knee injuries include the 3 C's, the collateral ligaments, the cruciate ligaments, and then the cartilages, which are called the menisci. Lateral blows to the knee, like you might have in football, can tear the tibial collateral ligament, the medial meniscus, and the ACL. So injuries affecting just the ACL are common in runners who change direction, basketball, twisting the ACL. But lateral blows to the knee, especially if it's extended, that can cause an ACL injury, and whenever twisting can cause an ACL injury. So sports like soccer, basketball, and definitely football, ACL injuries are very, very common, and they do require surgery. All right, and we're going to stop here. There's not that many left, but we've gone into, it's like 18 minutes. So I'm going to stop here. We'll start back at slide number 55 with our next recording.